When it comes to ear infections, it's good to have a little bit of knowledge of the anatomy of the ears. Outer ear infections, those are the ones that kind of get commonly called swimmer's ear. And summertime, kind of acute onset of pain after you've been in the pool, that's an outer ear infection, and usually something you're going to end up needing to see the doctor for. Probably the one that we deal with more are middle ear infections, and that's when the space behind the eardrum, basically the part that we look in with that otoscope and say, oh yes, there's something going on in there, is the space behind the eardrum, and that also has the eustachian tube, which is the plumbing. So that's an infection in the space behind your eardrum. That's called otitis media, and that's the one that we deal with the most when we start talking about antibiotics and tubes, etc. Symptoms of ear infection, probably the most common thing is ear pain. Obviously in a baby they can't tell you that, so tugging at an ear, just being fussy, not sleeping well, irritable, those are all common signs of it. In babies, especially if they're more fussy after they lay down, think about ears from that standpoint, because ears tend to plug up a little bit more when you lay down and might bother them when they're actually okay when they're up. Fever is another common sign, especially again in little kids. Older kids oftentimes don't get a fever. Older kids, it may actually be more hearing loss, or again, a lot of times they have pain. Ear infections seem to kind of be a rite of passage for kids. If your child hasn't had an ear infection by the time they're 2, you're probably in the lucky category. You should see the doctor if there's any persistent pain. You can give your child, or you can take a dose or 2 of Tylenol or Motrin, and if that takes care of it and it doesn't come back, that's probably not something you need to see the doctor for. But if you do that Tylenol or Motrin, and as soon as it wears off, you've got pain again, then certainly you should see him. You should see the doctor for any severe pain, temp that isn't going away in a day or 2. So basically the things that you'd take your child to the doctor for, that you'd go to the doctor for in any case. Most commonly, again, when we're talking about the otitis media, which is the infection behind the eardrum, usually for those you're going to get an antibiotic, and generally you need to take some Tylenol or Motrin as well for the pain.